Dr. Toney here. Calcium and supplementation. So here we go. What are the types of calcium supplementations out there? There's calcium carbonate, which is essentially garbage. There's calcium citrate, which is better than calcium carbonate, but not much better. And there's calcium lactate, which is your best source of calcium. It is the most bioavailable, meaning that your body can actually use it. It cannot use calcium carbonate. It's a waste. Science tells us that calcium carbonate is a waste. Yet why does our food industry put it in everything? Orange juice fortified with calcium. Calcium carbonate. It doesn't do any good. It's like eating chalk. Or remember this? Some people are older with gray hair, balding, they can remember this. Coral calcium. Eat your coral calcium. Garbage. Body can't utilize it. Calcium lactate is your best source. Supplementation is just that. It's supplementation. Meaning you should be eating the majority of your calcium through your diet, through food, through dairy sources, some plant, but mainly dairy sources. That's going to be your main calcium intake. You only supplement a small amount. It's recommended for, say, teenage years at about 1,300, depending upon the source, 1,300 milligrams a day. From about 19 to 50, about 1,000 milligrams a day. From 50 on, it's back up to 12 or 1,300 milligrams a day of calcium you should be taking in. However, we recommend a 250 milligram supplementation, which means you need to be getting the majority of your calcium through food. That's important. So there you go, calcium lactate. And of course, we recommend standard process, but any calcium lactate will do. In addition, what are the benefits of calcium? Because people think osteoporosis, and that's true. It prevents osteoporosis because you take in calcium during the day and calcium leaves your body during the day. If you don't have the appropriate amount of calcium, your calcium levels keep going down, down, down. Your bones are just a storage place for calcium. So if your body needs it for other things like, say, heart contraction, it's going to steal it from the bones. That's why our bones become osteoporotic over time. So, calcium is important. Calcium also is a bell curve, meaning that when you're a teenager, what happens is you start to curve. You have a certain span in your life where calcium peaks and then it goes back down. There's a density curve there. And so you want to get that curve up at the top. If you drink nothing but Coca-Cola as a teenage girl, your curve's going to come up like this, just barely. And then over time, 19 on, it's going to go down. If you start off here versus starting off here, what's going to happen to that calcium? It's going to plummet and you're going to be osteoporotic by the time you're 30. And we see this. We see women in their 30s come in and they're completely osteoporotic because they had poor diet when they were young. Eating calcium when you're young is very important. You want to build up the highest amount because over time your calcium density is going to drop off. That's just a fact of life. You could prevent that by supplementing with calcium, eating calcium-rich foods, and resistance exercise. Resistance exercise is very, very, very important. Women especially. Guys don't have osteoporotic problems as much as girls do. We're stronger, we're bigger, we're designed to do more moving and lifting. Women, resistance exercise, go on the machines, use the resistance machines. That will cause calcium to go into the bone because the body's requiring it to be stronger. Other benefits of calcium. There's studies that show that it fights cancer, colon cancer. There's studies that show that it increases the immune capacity, boosts the immune function. There's studies that show it helps with weight management. It helps with high blood pressure. And of course, as we mentioned, osteoporosis. So that's calcium. KISS series, Dr. Toney, calcium. Have a great day.